Okay, so for today's demonstration, I'm going to be performing wound care on an abdominal wound. So I've looked at the MD's order for the dressing change, so I know why it needs to be changed, and I know what I need to change it with, like what supplies I need, and I offered the patient analgesia beforehand, so I would have performed hand hygiene, gathered my supplies, performed hand hygiene before entering the patient's room with a general survey and safety check. So hi, my name is Sarah Kennedy. I'm a third-year student nurse from the University of Manitoba. I'm just here to perform your dressing change today. Is that okay? Good. And are you able to tell me your name and your birth date, your first and last name and your birth date, and then check on the armband too, the first and last name and the birth date. I just want to make sure that who they say they are matches what they have in their armband, and it should also match what was on the sheet for the MD's orders, just because I want to make sure I have the right patient for the dressing change. So today I'm going to be performing a dressing change on your abdominal wound. So just taking the old dressing off, irrigating it with normal saline, so essentially cleaning it, and then putting a new dressing on. Is that still okay to do? Okay, great. So I'm going to start setting up my sterile field. This table should be at waist height. It's a little low for the, I don't have a higher one, but that would be at waist height. I had cleaned this beforehand to make sure my surface is clean. I'm going to perform hand hygiene. I'm going to start setting up my sterile field here. So I'm just going to have a little garbage bag here. I also have one on the ground you can't quite see. Just being mindful of my 1-inch borders when I unpack. And again, just always being mindful of my 1-inch borders. So I'm not going to use a sterile dressing tray, and I'm going to pretend I have a garbage behind me, just because I don't have one right underneath me. Okay. And again, just always being mindful of my 1-inch borders. Okay, so now I'm going to start adding to my field. I'm going to set up my ruler here. So I have a 20 gauge cath on here. So I'm just going to drop it in just because the packaging's been opened a billion times, so it's a little hard to work with. But there would also normally be a needle attached, which I would need to retract later on, but just dropping that in. Okay, and then I have my 2 4x4. So this is what I'm going to be covering the wound with after I pack it. So I just want to put 2 by the side. And always just remaining mindful of my 1-inch borders. Then I have my 30 cc syringe here for the irrigation, winging that back, gently adding that to my sterile field. And then I'm going to add my scissors here. So normally these would be unopened as well too. So I'm going to add these into the field. I like to have them kind of propped up. Adding my cotton tip applicators. Okay, and then I'm going to add my Curlex. So normally this would be in sterile packaging, and it wouldn't be pre-cut. This is pre-cut just because they had to cut it a billion times, but normally it would be a bigger roll and in sterile packaging. So just winging that back, and then adding that to the tray. And then I'm going to add my normal saline. I want to be very careful because I don't want any drops of the saline to get outside the tray. So just being very cautious when I do this. And no drops are outside the tray, so that is good. So now I'm going to perform hand hygiene and put on clean gloves because I need to take the old dressing off. And I want to note the amount, color, and any odors that are coming off from the dressing or from the old dressing. So noting the color of the drainage on the old dressing, and then the amount, so like percentage, So you could say it's sanguinous or serosanguinous. Putting that there and then disposing of that. And I'm going to do more of an assessment once once the wound bed is clean as well. So I'm going to perform hand hygiene again. And now I'm going to don my sterile gloves. So again, being very careful when I put these on. These have been opened a million times as well. Being very careful when I put them on. Okay, so I'm going to irrigate with the 30cc syringe. I'm going to normally irrigate until the drainage runs clear, but I'm just going to draw up 10 cc's for the purpose of this video. And I'm going to work from cleanest to the dirtiest when I go. So I'm going to pretend the heads is to the far right, and I'm going to go from more of the center to the outside. And I don't want to go really on the peri wound because I don't want to bring any contaminants into the wound bed. So drawing up 10 cc's. And again, being mindful because I don't want to get any drops outside the tray. And then from about 10 centimeters away. And then being very careful because I don't want to get with it outside the peri wound. Right, I don't want to let it hit the peri wound because I don't want to bring anything new in. Okay, and then for the purpose of this video, I'm not going to use the full 10 cc's because that would just be a mess. So I'm going to pretend I irrigated until it ran clear. I'm going to dispose of that, and I need to dry. So I'm going to use, when I dip this in to sop up the normal saline, I'm going to just hold it steady, and I don't want to let it touch my gloves or the saline touch the gloves because I don't want to contaminate my sterile gloves. So just gently putting that in. That's going to sop up, and then disposing of that before it's able to touch my gloves. And then there's still a bit more water, so I do want to use another one. So, and it should be about as moist as an eyeball there, so disposing of that. And now I need to clean my peri wound. Dabbing that. And then one swipe per wipe, going from cleanest to dirtiest. So if that's the head to the far right, one swipe per wipe. One swipe per wipe. Dabbing that again, get some saline on it. And then one swipe per wipe to the other side. Okay, and then I need to dry the peri wound. So I'm gonna be making 2 more rosettes, and then still using that one swipe per wipe method. One swipe per wipe. So let's pretend that hit the garbage, and then again, one swipe per wipe to the other side. So at this point, I want to be assessing, doing a wound assessment now that it's clean. So I'm looking for any signs of healing, the condition of it. I don't see any obvious tunneling or undermining, so I'm not going to poke and prod at it. I do see some granulation tissues, but I want to measure the length, the width, and the depth. So I'm going to go, the length is 13 centimeters. The width is about 3 centimeters, and then the depth is about 2.5 centimeters. So disposing of that. So now that I've assessed the wound and the wound bed and the peri wound and looked at all that, I'm going to start packing. So I'm going to pack with the pre-cut Curlex. So normally it wouldn't be pre-cut. I could cut it a bit so it's a bit easier to work with. So I cut a bit to make sure it's easier to work with, but it's already been pre-cut. And if there's any excess, I would want to make sure to cut that as well in real life scenarios. And again, being very mindful because I don't want any drops to get outside my tray. Okay. So I'm going to be packing. I don't want to pack too tightly, and I want to make sure I'm not touching the peri wound with the Curlix because I don't want to bring any new contaminants into the wound bed. So I'm not packing too tightly. And again, so it's pre-cut here, but if it was too long, I would cut it to the length that I need because I don't want any excess. So I'm just going to lay that there. And I don't want it to go, anything to go above the surface of the wound either. I just want it to be nice and flush. So I'm going to put that down. Making sure all the surfaces are covered. It's not going too far. Okay, so I'm happy with that. And I'm going to show you the packing once I'm all finished at the end because it'll be a bit easier to work with my camera. But I'm going to dispose of that and then grab that. I'm no longer sterile, but I'm going to put my 2 4x4s on top. Putting that there. And then I'm going to put my abdominal pad. And then just because the tape's hard to work with gloves on, I'm going to take these off, perform hand hygiene, and I'm going to put the adhesive medical tape over at the corners. Okay, and then so that would be my dressing change, and then I would document about it as well. But I just for the purpose of this video, I do want to show you what my packing looked like. So I'm going to take that away. I'm just going to show the camera here. So there we go. Okay,